Is cannabis just a drug? Or is it the medicine we've been ignoring for quite some time now? What if the possibility was there for this plant to reduce a child's seizures by 99%, a 600-fold drop? Or help a son or daughter say goodbye with a little more peace? From cancer treatments and palliative care to epilepsy and chronic pain, here's why cannabis might deserve a second look. For cancer patients, chemotherapy isn't just hard, it's debilitating. Imagine battling not just a disease, but the relentless waves of nausea that steal away your energy and chip away at your hope. Every meal feels like a mountain to climb. Every day a struggle just to feel normal again. What cannabis can do is step in where other treatments fall short. Once ingested, it connects with your body's own cannabinoid receptors, almost like a key finding the right lock inside you. These receptors help block the signals that trigger nausea, offering relief when nothing else can. Clinical trials have shown that 1-to-1 THC-CBD combinations can significantly reduce vomiting, even when standard anti-nausea treatments fail. For many, it's not just about easing the symptoms. It's about reclaiming a piece of themselves. It's the difference between feeling like a patient and feeling like a human again. Meet Charlotte Figge, a little girl whose battle with catastrophic epilepsy ignited a global movement. Charlotte went from 50 seizures a day to just 2 or 3 a month, using a CBD formulation now called Charlotte's Web. In epilepsy, especially Dravet syndrome, neurons tend to release too much glutamate, leading to a storm of uncontrolled electrical activity. This overactivity can result in prolonged, frequent seizures, exactly what Charlotte experienced with her 50 seizures a day. CBD helps by reducing glutamate release, calming the overactive neurons that were firing uncontrollably. By dialing back the excitatory signals, CBD helped prevent the electrical overload that triggered her seizures. Chronic pain doesn't just hurt, it hijacks your life. An estimated 20% of the world's population suffer from it daily, trapped in an endless cycle of discomfort. Cannabis taps into your endocannabinoid system, dialing down the pain signals in your brain and easing inflammation throughout your body. And here's the game changer. Unlike opioids, it won't stop you from breathing. In a world where 80% of overdoses within Australia are from pharmaceutical prescribed drugs like opioids, surely we should offer the patient an option that doesn't involve possible death. For those nearing the end of life, comfort isn't a luxury. It's everything. Cannabis steps in to provide dignity and peace where it's needed most. It eases pain, restores appetite, and soothes anxiety. Studies show medicinal cannabis significantly improves the quality of life for terminal patients, offering not just relief, but peace when it matters most. So here's the big question. If a plant can ease suffering, improve lives, and offer hope when there was none, why are we still debating its use? The numbers, the stories, they all point to one undeniable truth. Cannabis has real, transformative medical value. So yeah, the conversation has started, but it's up to us to keep it going. If you think this is worth talking about, talk about it. Let's work towards a future where suffering isn't ignored. If you want to dive into it a little deeper, you'll find it below. Stay curious, stay informed, and as always, peace. Thanks for watching. If you found any of this interesting or just curious to know more about cannabis in general, you can find it at 2 Birds, 1 Stoned. Links in the description. Have a gander. Good luck.